Good morning, everyone. So my topic is all about diseases and how it can affect to our globalization. So SARS is, or also known as severe acute respiratory syndrome. So this is a new respiratory disease. So it is first encountered in 2002, and the cause it is caused by a newly identified coronavirus. So it is part of the coronavirus. In an outbreak of SARS, it is occurred in 2003, when the virus spread largely via airline passengers from mainland China to Hong Kong and from there to Singapore and Canada. So while the outbreak had only a limited effect, it demonstrated that globalization contributes to the spread of such disease. So this is the history of infections of coronaviruses. So this SARS is part of the coronaviruses. So first it is identified in 2002 and 2003, the SARS, and it is located first. The first affected person is in Guangdong province of China, and it is a beta coronavirus. It transmitted from bats to civets to human, and it is began in February 2003 and outbreak lasted until July 2003. It has more than 8,000 total cases and 774 deaths. The fatality rate of deaths is 9.6%, and then followed by the MERS, which is occurred in 2012, and then the novel coronavirus, which is occurred in 2019, and which is relevant until now. So this is the chart that shows the date of the cases or the disease in our world facing. It is an epidemic or pandemic disease. So we have here the two types of tests which to detect the source or the coronavirus. The first is the molecular test and the second is the antibody test. So this molecular test, which is means the nucleic acid detection. So it diagnoses active SARS or coronavirus 2 infections. The first step of this test is to we need to obtain specimen swab or also known as swab test. The second is we need to extract the RNA from a specimen and convert to DNA. And the third is amplify by the PCR with the SARS-CoV-2 specific primers. And the fourth step is to interpret the results. The presence of the viral RNA that indicates an active SARS or COVID-2 infections. And the second is the antibody test, which is also known as the serology. So detect the immune response, it is to SARS or COVID exposure. Yung isa is diagnose, and then this is to detect the immune response to SARS or COVID, COVID-2. So the first is blood sample, like blood test. And the second is we need to expose the specimen to SARS-CoV to the specific antigens. And the third is interpret the result or color change that indicate the previous exposure of SARS-CoV-2. This is really the most effective way to detect the virus is the antibody test. Na yun. So this picture is a 45-year-old Hong Kong resident which has a severe acute respiratory syndrome of SARS. It shows the bilateral peripheral shadow, and the letter B, it is a after flash metal iprednisolone showing resolution of chest X-ray or CXR. It is shadowing the CXR and provided the courtesy by Dr. Kui Chung. So this is the week one. The week one is like illness patient. It is initially developed the influenza like prodromal symptoms. It is presenting the symptoms of including fever, malaise, headache, and rigors. So this is the example of the X-ray of SARS. So It also it also has the symptoms of cough, a dyspnea, and diarrhea. It is also may be present in the first week, but are more commonly reported in the second week of illness. So that's why we have a quarantine. At this stage, it is up to 70% of the patients develop diarrhea, which has been described as a large volume and a watery without blood or mucus. What is diagnosis of the a SARS? The first is we have here the critical care, the steroids, and ribavirin. So the critical care is like an early intubation of patients with an impending respiratory failure, and it is preferred, or already preferred. And the steroids, this is the current recommendation. It is to consider the moderate doses of steroids in severely ill patients with SARS. It is with increasing oxygen requirements like PaO2 below 10 or kPa or oxygen saturation. It is below 90% in air. So while the ribavirin, it is the evidence for the efficacy of the ribavirin, it is lacking. It has been lacking use blindly in the early stages of the epidemic. So we also have other treatments of SARS that is already generated in our country, not only our country but worldwide. So first is the new drugs and vaccination. These new drugs is discovered by the Frankfurt team and also discovered in other German group. So this vaccination, it's have a vaccination combat SARS. So these vaccines already exist for normal coronaviruses. It also this vaccine is a biologist. It is also applying the expertise of SARS 60 to 61 viruses techniques for the vaccine development. And it is developed a prototype vaccine against coronavirus that causes a bronchitis in chickens. We have Nick. What is Ebola virus? Ebola virus transmission. So Ebola virus disease or EVD has acronym. This is the example picture of Ebola virus disease or Ebola virus. So this is the Ebola virus. So as you can see, it is very large. Ebola viruses are large. The length, it has length equals to 970 nanometer, and the diameter is equals to 80 nanometer. Ebola virus first identified in Zaire, Sudan, and then to Zaire. So it is called a Ebola because it is first identified located in Ebola River. So the Ebola virus was discovered in 1976. As you can see, this is a hemorrhagic fever outbreaks in Central Africa. So it damaged the blood vessels. It can also affect the multiple organs, and it is also can affect our bodily self-regulation. So the Ebola virus is most has a lot of cases in Africa, within the Africa, and the major outbreak uh, is in West Africa in 2014 and 2016. So the typical Ebola virus symptoms include symptoms of Ebola. So we have here in the brain part, headache, and then red eyes. And then in the thorax and lungs, we have hiccups, sore throat, difficulty breathing, difficulty swallowing, and then in chest pain, stomach. In the stomach, we have a stomach pain and the vomiting. So in the skin naman, we have bleeding. In the systemic, we have fever, the lack of appetite, and then internal bleeding. In muscular part, we have aches and weaknesses. In joint, we have also aches, and in intestines, we can also experience a diarrhea. So the diagnosis of the Ebola virus, it can be difficult to clinically distinguish the EVD, like it from another infection disease such as malaria, typhoid fever, and meningitis. Many symptoms of the pregnancy and Ebola disease are also quite similar. That is why it is very difficult to distinguish the Ebola virus disease because it has the rest to the pregnancy. Pregnant women should ideally be tested rapidly if Ebola is suspected. So the sample collected from the patients are an extreme biohazard risk, like in laboratory testing and non-inactivated samples. So it should be conducted under the maximum biological containment conditions. Like all the biological specimens should be packaged using the triple packaging system. It is when transported nationally and internationally. So, so we also have a treatment in um, Ebola virus. So it has a supportive care, the rehydration with oral or intravenous fluids. So the treatment of the specific symptoms improve the survival. The range of the potential treatments, including the products, immune therapies, and the drug therapies, and it is currently being evaluated. So this we have here the two monoclonal antibodies, which is the Enzaziv and the Ibanga. So it is were approved for the treatment of Zaire Ebola virus or infection in adults and children by the U.S. Food and Drug Administration in late 2022. We have also the vaccines of the Ebola virus in May 2020. So the European Medicines Agency recommended granting this marketing authorization for two-component vaccine called the Zabino and the Mavia for individuals. So 1 year and older, the vaccine is delivered in two doses. Like Zabdino is administered first and Mavia, and it is given approximately 8 weeks later as a second dose. So this prophylactic second dose regimen is therefore not a suitable for an outbreak because it responses where immediate protection is very necessary or essential. So the third topic is what is the tropical diseases in Europe. So the tropical diseases in Europe. So the first case of this epidemic of a tropical diseases is mainly developed in European country. Because of the climate change, it creates the condition that make it easier for the mosquito to survive. And it opens the door to diseases that didn't exist there to their country previously. So this is a real issue. It is a very real issue. So now today it is not something like a crazy environmentalist warning that is warned about. So for example, the tiger mosquitoes arrived in Italy. It's about a decade ago from Albania in the shipments of tires. So since then, the mosquito has been spread throughout the southern Europe and even in the Switzerland and to the France. So this mosquito spread a tropical disease. So the chikungunya, a relative of dengue fever, it is usually found in Indian Ocean area. So by drinking the blood of a person, it is transmitted by the mosquito by drinking their blood to a person and then passing it to those the mosquito subsequently bite. Like